My interest in medicine started pretty early. I was in high school and I had a natural gravity towards the life sciences. I was involved in research pretty early on. I did a NIH-funded research project when I was in high school. My father worked in a hospital, so I had exposure to physicians, and that's where that spark initially came. I was fortunate to be able to get into medical school from high school itself, and I went to a joint program at Northwestern. Throughout my college experience, I kept looking for other things that would bring me passion and excitement, and it was really just medicine that got me excited, got me thinking that I really want to help people with everything I learn. I want to work with my hands. And then I ran across interventional radiology, which is principally based on minimally invasive procedures. We do big things through tiny pinholes, and that's what really fascinated me, that people really get better after our procedures, and things that required surgery before don't really require big surgeries, and we can solve them with shorter hospital stays and so on and so forth. So that's really what got me excited about the field of IR. As an interventional radiologist, I can treat patients that have bone problems, such as compression fractures of the spine. I can treat patients that have problems in their arteries that cause wounds to not heal, diseased veins, patients that have cancer. I'm happy to help patients with a wide variety of problems. And I think for our patients, it's really important because we have this multidisciplinary approach to patient care, which oftentimes you don't see very well outside of academic centers. So what I'd like to bring to Fort Edward South is this academic level care here, and work with our colleagues in a variety of specialties to really offer what's best for the patient. When I see a patient, I want them to know that I have a background of rigorous training. I do a lot of procedures. I enjoy doing procedures. I enjoy working with my hands, reading their CTs, looking at the CTs and seeing, is there something I can offer to this patient. But I like to put that aside in front of my patients and tell them that I really want to do what's best for them. In many circumstances, a procedure may not be in their best interest. Maybe a surgery is more suited for them, or maybe medical management or something that is a little less invasive than even a procedure. I want them to know that just because I can do something doesn't mean I will if it's not for the right reason. Before we do any procedures, before we talk about any procedures, I like to get to know my patients, see what brings them to my office, see what's really bothering them. Maybe the reason they were referred is not really what is concerning them, and I'm happy to work with them and see if there's another way we can help them. A mentor in residency always told me, look at every patient as if they were your mom or your dad and approach them that way. And that's my approach to patient care as well. Hi, my name is Omar Uddin, and I'm a vascular and interventional radiologist here at Fort Edward South.